Hello everyone. As we all know, today is Blood Donor Day. World Blood Donor Day is held on June 14 each year. The event was organized for the first time in 2005 by a joint initiative of the World Health Organization, the International Federation of Red Cross and Red Crescent Societies to raise awareness of the need for safe blood and blood products and to thank blood donors for their voluntary life-saving gifts of blood. Today, I am here to present the importance of blood donation and its various aspects. You don't have to be a doctor to save lives. Just donate blood. It's safe, it's simple, and it saves life. Blood facts. Blood flows everywhere throughout the human body. We cannot live without it. The heart pumps blood to all our blood cells, supplying them with oxygen and food. Blood also carries proteins and platelets that let blood clot where there has been an injury. Did you know 450 ml of blood can save as many as 3 lives? Every 2 seconds, someone in India needs blood. 1 out of every 3 of us will need blood in our lifetime. Even with all of today's technology, there is no substitute for blood. Here are some facts about the blood donation. Hospitals predict that the need for blood will increase 5% each year. Approximately, only 4% of the eligible population in India donates blood. 75% of donors donate only once per year. If they donated just 2 times per year, there would never be any shortages. A person has 5 to 6 liters of blood in their body. A person can donate blood every 90 days, that is within 3 months. Body recovers the blood very quickly. Blood plasma volume can be recovered within 24 to 48 hours. Red blood cells can be recovered in about 3 weeks. Platelets and white blood cells can be recovered within minutes. Now, here are some reasons to donate blood. Blood is always needed for accident victims, cancer patients, blood disorder patients, surgery patients, premature preterm babies, and many others. 1 out of 10 hospital patients needs a blood transfusion. 4.5 million Indians' lives are saved by blood transfusions each year. Here are different blood groups: A positive, O positive, B positive, AB positive, A negative, O negative, B negative, and AB negative. Look at the screen, then you can see which all blood group can donate and receive blood. O positive blood group is called as the universal donor and AB positive blood group is the universal recipient. Then we can discuss about the concerns of blood bank primary. Then we can discuss about the primary concerns of the blood bank. Safety of blood donor and blood recipient, because safe blood can give life, unsafe blood gives infections. To ensure blood safety, we can do is that strict donor screening at the camp should be done, testing of collected blood to WHO, World Health Organization, specified standards, strict cross-matching of blood samples to ensure safe transfusion to patient. Let us know about the importance of blood donation. Body is functioning only by human blood. Excessive loss of blood can be seen in accidents. Spare blood can preserve for a maximum of 35 days. Excessive bleeding, dengue fever, blood cancer, and general deficiency of blood must receive blood as soon as possible. Now, let's know the information before donating blood. Blood is taken only from voluntary donors using sterile, disposable blood bags and instruments. Donated blood is tested and separated into components benefiting 3 to 4 patients. It is safe to donate every 3 months. It is quick and safe. It doesn't hurt. It saves 3 to 4 lives. So, here are some procedure for blood donation. Before donating, donor screening, donor eligibility criteria, deferral criteria, that is donor consent form, and medical examination should be done. After that, blood can be donated. After blood donation, rest, advice, and refreshment should be taken. A donor certificate, donor ID card will be given after the donation. The first step before donating blood is the donor screening. Safe donor selection involves identification of low-risk populations, donor education and recruitment, encouraging self-referral based on referral criteria, medical examination done before donation. Voluntary, non-remunerated repeat donor is the safest donor screening. Second one is the donor eligibility criteria. Who can donate? Age group between 80 to 60 years, weight more than 45 kilograms, hemoglobin level more than 12 kilograms per deciliter for men and 12.5 grams per deciliter for women. And finally, the donor must be in a good health. The next one is deferral criteria, that is donor consent form. Postpone donation for 6 months if you have risk factors for HIV or AIDS, such as having sex with more than one partner without using condom for vaginal, anal or oral sex, intravenous drug abuse, having sex with a person who could have the above risk factors. Deferral criteria, who cannot donate? Abnormal bleeding disorder, heart, kidney, liver disorder, thyroid disorder, epilepsy, mental disorders, tuberculosis, leprosy, asthma, cancer, insulin-dependent diabetes, uncontrolled high BP, cannot donate blood in their entire life. Surgery, typhoid, dog bite, unexplained weight loss, continuous low-grade fever, cannot donate blood for 1 year. Tattooing or body piercing, dental extraction, root canal treatment, malaria, vaccination taken cannot donate blood for 6 months. The people involved in this criteria cannot donate blood. Another deferral criteria is that female donors cannot donate blood during pregnancy, after delivery for 1 year, when lactating, during menstrual period and for 7 days thereafter. Male donors cannot donate blood if consumed alcohol in the previous 24 hours. Medical examination at camp. Blood test is done for blood grouping, hemoglobin. Blood pressure, pulse, general physical examination is also taken at the camp. Remember that you, the donor, must have had good rest, that is, you should have enough sleep, have had light meal, and be mentally prepared for donating blood. Here are some advices after donation. Drink lots of fluids for next 24 hours. Avoid smoking and alcohol. Avoid highly strenuous exercises and games for a day. Remove Band-Aid after 4 hours. Testing at blood bank for transfusion transmissible infections. Blood collected at the BDC is screened using highest quality screening test for 6 TTIs. Here are the 6 TTIs, that is HIV-1, HIV-2, hepatitis B, hepatitis C, VDRL, that is syphilis, and malaria. Blood products and their uses. Blood collected is screened for TTIs and, if safe, is separated into components and stored for issue to patients. Whole blood is used for exchange transfusion in babies, accident victims, complicated delivery cases, and some specific surgeries. Blood components is used as red cells for anemia, fresh frozen plasma for clotting disorders or burns, platelets or platelet-rich plasma for cancer and dengue, cryoprecipitate for clotting disorders, cryopoor plasma for burns. There are a lot of health benefits for donor. Regular donation, that is from 2 to 3 times a year, lowers cholesterol, lowers lipid levels, decreases incidence of heart attacks, strokes. Donor is also eligible to receive 1 free unit of blood if needed for self, spouse or children or parents and even friends. What can you do as responsible citizen in saving life? Make blood donation a habit. Donate regularly every 3 months to commemorate special days like birthdays, anniversaries, etc. Motivate others to donate. Refer your friends and relatives to contribute. So dear, last but not the least, if you donate money, you give food, but if you donate blood, you give life. Thank you. Hope I had created some awareness and inspired you all to donate blood as a responsible human being. I would like to urge everyone to contribute in saving life. Once again, thank you all for your patience and kind listening.